everybody. Welcome back to Opria's Open Mic. You're still so dumb.
Yeah, it's a great one.
Guess what? We have something really special today. Not him. We have, this is a doctor that has changed my life. This is Dr. Tara Allen, and she is incredible. She is a female, well, she's obviously a female, but she's a urologist that specializes in female issues. And
you are not the champion of the uterus, I heard earlier.
The champion of the uterus. I love uteri. They're important.
Uteri are great. Yeah.
But I'm more a lover of the bladder, I would have to say.
A lover of the bladder. Never heard anyone talk that. I just get really pissed at my bladder all the time because I was always peeing in my pants.
You're not pissed anymore.
Not anymore. I'm dry, baby, dry. But that's what you guys, this is something I look back and I was like, why did I wait so long? Because it's an issue I've had for well over 10 years, and I just dealt with it. I peed in my pants. You wear black, and you're like, well, it dries. And I'm like, well, if I'm real hydrated, it won't smell.
Oh, my God, it smells so bad. As the guy who does all the laundry.
The laundry guy.
It's awful.
Only when it dries for you, baby. So what was it? It's been a week and a half now, and I was not skeptical, but I was like, it can't be this easy because, you hear the sling and it's a 6-week recovery. But I went in and you're like, no, you're a great candidate for Bulkamid.
Bulkamid.
Mm-hmm. Oh, I was like Little Mermaid. That's how I was remembering that word, Bulkamid. But so what exactly is that? Because I don't know how to explain it. I just know that it fixed my issue.
It is a water-based gel. It's 97.3% water, and the other 2.5% main ingredient is polyacrylamide. This is just a little linear polymer that loves water and basically serves as a scaffolding that keeps the water droplets from reabsorbing into your body. So it just creates little mounds in the urethra that keep your urethra closed a little bit better than you would be naturally.
Okay. So how long has this been out? Because I had never heard of it. Somebody on Instagram tagged you and said, when I talked about one of my million times peeing in my pants, someone said, you have to go see her. And I was like, And they're like, you can get fixed without having any downtime. I was like, okay, now I'm intrigued. So when did this start? Because I wish I would have known sooner.
So it was FDA approved in January of 2020. This compound has actually been around for a really long time, though, and it's been approved by the EU in Europe at least 15 years. I don't know the exact dates on there, but because of that, we have excellent long-term data with it, and it's just, though, really getting popular in the U.S. We initially, when we started to offer it, we were offering it in the operating room, and it was really hard for me as a provider to say, yeah, let me do this little mini procedure in the operating room with you asleep when I could just do a sling at the same time and have what I would consider more durable results.
It did not need an operating room.
No, it did not.
It was so easy, so quick. It was
initially,
wonderful.
the coverage prevented us, the insurance coverage, even though it was there, it prevented us from doing it in the office. They wouldn't cover our expenses. And so between the insurance company and the excellent support of Axonics, the company who brought Bulkamid to us, we have got to the point we can offer it in the office. Yeah. And as you guys saw, it was
quick, safe. I really thought you were going to let me do one of the.
I should have.
But I don't know. You said no.
He's like, wrong hole.
No, there's like one hole. I mean, come on.
Oh no.
There's one.
But this is how it went, though. It was literally the easiest procedure. Was I nervous? Maybe a little bit more anxious, like I don't know what's about to happen, right? Mm-hmm. But you guys offered laughing gas, and I was puffing it like a champ. I was like,
the only thing that made you nervous was you didn't think it was working until all of a sudden you were high as a kite.
I was high as a kite.
I don't think it's working. Can you turn it up? I can't turn it up. Did they give me enough? Is this on? I think you were hyperventilating. You were getting high just on the lack of oxygen. Yeah, I don't think she was breathing out.
But laughing gas, you don't have to have that.
You don't.
So the insurance doesn't cover that.
They don't. It's a nominal fee. It's about
like
$150, something like that. But I do find that most people are happy they did it. No pun intended with laughing gas. But
I mean, it's kind of fun.
It is, but it definitely takes the edge off. It helps people to relax their urethral sphincter. And we do find that the flow through the scope is a little bit easier whenever they are on this. And so we feel like the procedure goes more smoothly from our standpoint when they use the laughing gas.
There was a woman that came in after us when we were just waiting to leave, and they were debating on whether to have laughing gas.
And we're like, do it.
So I chimed in. I'm sure I was like, that sounds great. Do it. Yeah.
Can I hire you to just sit in my waiting room?
I don't know if she appreciated that or not.
All right, so we get the laughing gas. I'm a little high, and then you come in, and you said that's where it's going to burn a little bit because you do an injection. That's just basically a numbing.
Yeah, that was just lidocaine, 1% lidocaine. What the dentist then go to after when they're taking a tooth out.
Don't compare this to the dentist. This was way better than the dentist.
But it just offers that second level of analgesia and just helps you to be that a little bit more comfortable. Now, it's a debate across the country whether or not we even need that injection. So if there's a doctor out there who's not doing it, it's because they feel like in their hands it's better without it. There's the logic of, well, it's only 4 injections anyway, so you're going to add 2 more by doing a periurethral block. I do think that in my patients, they feel more comfortable using it. And you barely flinched. I know it was a little uncomfortable, but you barely flinched. You are a Marine, but
I would say the pain was like a 1-ish on a scale of 1 to 10.
So that for all the normal people out there, that's a 4.
That would make sense because people do somewhat withdraw a little bit whenever we're doing this. And occasionally there will be the person who says, you know what, that was like a 7 or 8 and that was not comfortable, but that's unusual.
That's just normally weak bloodlines, right?
Yes, be nice.
What? I'm just saying that if that's simple of a procedure, and it's like, oh my God, that hurts so much. Like,
as he's
maybe
the one
you should
that
look
gets
at
a
your
needle
ancestry.
and passes out.
Oh yeah,
Sean gets a shot in his butt and he passes out. So weak bloodline is right there.
It all just goes black and white, and I just kind of reboot.
So then after the numbing, which it has when I say slight burn, it is so slight. It's like a quick prick and a slow slight.
It ain't burning, it ain't working. See?
Don't listen to him. He has no idea. He's like, you're fine, honey. No, he's not. He's filming. He's like, ha, ha, ha. And then after that, so we showed it on the video. So we will play the video, but we showed on the video how it closed, which I thought was really fascinating to watch because you just have a camera up there and we put on a screen.
Right. So we put the small scope into your bladder, and I am watching the same thing that you're able to watch and seeing that opening.
Levi, roll the footage of my girl's bladder. There you go, girl.
At my fingers.
What's wrong with you? Puff, puff, pass.
And then probably the worst part is a little bit of a burn. What I'm doing is injecting.
It's not bad.
Good. It's lidocaine in the periurethral area. So we've already started with the wonderful Pronox to give you some relief. And this gives us just another layer. And, obviously you're not going to be asleep for this, so we want you asleep.
So
you'll be able to see it on the screen.
Okay, so it's not Botox for the vagina and peeing in your pants. What is it?
Okay, this is an injection. Yes, that's the only way it's similar to Botox. But Botox is more for overactive bladder. The gotta go right now. This is for the cough, laugh, sneeze leakage. Cough, laugh, sneeze, run, jump.
That's me.
Yes. So this is a bulking agent that is working by just pure physics. We're just making that urethra a little bit tighter.
Permanent?
It is not permanent. It is 98% water. It's about 2% of scaffolding that keeps the water droplets from absorbing. In their studies, that we have shown efficacy up to 7 months. But does everybody get I am completely happy results from the beginning? No, we don't. And if those folks don't have I am completely happy results at the beginning,
that's about 2%.
That's when we think about doing a sling. But the majority of people who have a good result, it will last. And again, 5 to 7 years is the data. I've had
Hey,
patients
this
come
could last
back.
7 years?
That's pretty
Holy shit, that'd be amazing.
I have had patients come back though sooner than that and say, I don't even care that I need to repeat it because it was such an easy process
Easy.
So
that I don't mind doing
repeating
again.
it is okay.
Completely
You don't
fine.
instantly go to a sling after this is done.
No. If even 6 months from now, she did great for 6 months, and then 6 months she's like, oh, I'm leaking a little bit again. Then we could do a top off.
Holy shit, this is going to be awesome.
Yeah, it's gonna make her happy.
All right, thank you.
Be back soon, okay?
Thank you, guys.
You're welcome.
What we're starting with is a little bitty tiny cute scope, and she has already been numbed. You're going to feel a little bit of fluid down here. It's a little unpleasant because it's cold, but it'll be fine. You'll feel the scope. And so we see the urethra as we're going in,
You're watching heaven.
and this is the inside of the bladder. So this is the end of the ureter where the ureter empties into the bladder on the right. This is the inside of the bladder. So this is the end of the ureter where the ureter empties into the bladder on the right.
Everyone's like, well, you just need to do Kegels. I've gotten that 5
Okay.
million times over.
All right, so this is you at rest.
That is
Now-
your bladder, correct?
No, this is the urethra. I'm
The
standing
urethra at rest.
at
Now,
rest. Now squeeze. That's your urethral sphincter. Now relax.
Good job.
There you go.
so it's not that it's weak. It's not that I
You're
haven't done my
squeezing.
Kegels. It's that
Where I injected was right here, which was closer in between the sphincter and the bladder neck to get that area closed.
so Kegels would not have fixed it.
So not necessarily, no. You're one of the strongest gals I know, so I seriously doubt this is a skeletal muscle
You got
issue.
Kegel powers. They weren't helping.
You remember we had talked about how there was some urethral hypermobility there, and
Oh,
for that
gotcha.
reason, it's more important for your bladder neck to be completely closed. Our bladder neck when we're 18 years old is completely closed. As time passes, various
sorry.
things
No,
cause our
you're fine.
bladder neck to kind of stay open at rest. And so this helps that area between the sphincter and the bladder neck to stay touching. Coapting is the fancy word we use.
Gotcha.
Okay.
Guess what? First jump rope, no peeing. I'm kind of in shock. And I sneezed today, didn't pee. This is a victory. Now let's see if it lasts.
Okay, now that you're all watching it.
And so, what is it that's actually closing? Because you can't fully close it because you have to be able to pee.
Right. So there is a space that's about 2 centimeters long, which is about an inch, between your sphincter, that muscle that I showed you on the video, that when you voluntarily squeeze, you see it close down, and the bladder neck, where the bladder actually joins the urethra. There's an inch space in there. And our goal is to be about a half an inch away from that bladder neck. And we bulk up that area, and it just provides more resistance to just spontaneous flow, involuntary flow.
Well, there was a decent, I don't know what I'm looking at, but there was a decent opening before you put in the Bulkamid.
That's correct.
And then when it was done, to me, it looked like there was zero opening.
Yeah.
Right? But it doesn't stop somebody from
It
peeing.
does not.
Some people have said that, though. They had a hard time peeing after they had it done. Is that something you see?
Yes, we do. There's almost everyone has an element of hesitancy, and except for you because
I was
everything went
dying
perfect.
to pee.
We do feel you quite full, so you do have a strong urge, and if you have a good strong bladder muscle, then you are going to likely pee just fine.
My girl's strong.
But exactly, we've all seen. But some people do have retention. Now, as far as the risks of that, as you get older, your bladder muscle gets weaker, and your risk of having a hard time emptying your bladder get a little bit higher. But as of yet, I've not had anybody have to use a catheter more than a week after this procedure.
Oh, some people have to use it for up to a week.
But those ladies were in their late 80s and 90s.
Oh, like
and
definitely older,
so
okay.
it's something that it's not unexpected because their bladder muscles are weak, and they're still very happy with their results.
Oh, good.
Oh, okay. So is there an age that if you're doing it 80, 90-year-olds, is there, it's for everybody. There's
It
not
is-
an age limit. Is
It's
it,
truly for everyone?
do you ever have young people like in their 20s after maybe some people have had kids young and they're having an issue?
Absolutely.
Okay, here's another good question that I get a bunch of. Well, actually, I just got a bunch of people that are like, how about you just do your Kegels, Erin?
Yeah.
I hear that.
On a scale of 1 to like can win a competition, how strong is my girl's Kegels?
0.
20.
Yeah, that's what I'm talking about.
I know Kegels are amazing, and I'm not knocking them. I think everybody, if you're struggling, you need to learn to do Kegels. Not everyone knows how to do them.
That's correct.
They don't know how to do them correctly, correct?
That is so correct. There are so many people out there who think that squeezing their butt cheeks is a Kegel.
No.
And if you're bouncing up and down on a chair, you're not doing a Kegel.
No.
So
it's more like a tuck.
You're tucking. Probably the best way to simulate that contraction is if you're about to pass gas and you're holding it in.
I never thought about it that way.
That's a good way to describe it. Or if you're sitting there peeing and you're trying to stop your stream, of course that's a Kegel exercise as well.
So wait, I'm doing this while you're talking, by the way. So I've got
Me too.
I'm like holding back gas that's not happening. So do men have Kegels? And I know this is about your procedure. I'm not trying to hijack that. It's
Absolutely.
not about men. I'm just curious.
And where this applies, men who have had their prostate removed are very prone to leakage. And if they start doing Kegel exercises a few weeks ahead of time, then their leakage is dramatically lower.
That's cool.
So our muscles are very important. And I can't say enough positive things about pelvic floor physical therapist. I send to pelvic floor physical therapist more than I do any other doctor. They are so important in continence care. With that being said, I do see patients who have very strong Kegel muscles, yet they still leak. And this has more to do with the support of the urethra to the pubic bone, as well as in the older ladies that are postmenopausal, the lack of estrogen in the vaginal skin plays a role.
Oh, that's a question I have too. How does estrogen play a role in this?
So when our vaginal skin, which surrounds the urethra, starts missing estrogen, it gets thin, it gets tight, it cracks easily. It's just not as pliable. And we do know that you have an increased risk of stress urinary incontinence. Now,
is that a different type than I have?
It is still stress incontinence. You actually could have an increase in urge incontinence as well for the same reasons, lack of estrogen. But no, it's the same, but the same thing you have, but for different reasons. Gotcha. So the lack of estrogen, the lack of muscle tone, and the lack of urethral support all contribute to stress incontinence.
Nice, but I do 100% agree that if you have an issue, see a doctor, get a recommendation to get to pelvic floor physical therapy. Try that first or do it simultaneously. But you still, even if you did this, you still need to have a stronger pelvic floor. It's very important to have.
So stress incontinence, is that what technically Erin had?
Yes.
Okay.
Yes.
How do you think that happened to her? Like, as far as we know, I mean, you're not 80. And you're not postmenopausal.
This has been my philosophy. Is mine wasn't after I had kids. It was when I came back from war, and we were in convoys, and so boys would pee in the bottle. Well, girls, there was only 2 women, so they didn't stop for us. So you just didn't pee. So you just held it for ever, 15 hours. And when I came back from war is when I had my issues. So I don't know. It was after kids. Like, it didn't happen right after kids. It was.
But you were also in war. You were also like really probably challenging your body in ways that had never been challenged before. I carried a lot of weight. Exactly. So when I talk about childbirth,
you used to be heavy.
Be nice.
Oh, I'm sorry. Oh, a backpack full of like bombs and guns and stuff?
All the good stuff.
Hand grenades.
Hand
she
grenades.
kept
Lots
one
of hand grenades.
for moments like this.
Just for you to throw at you. But so extra weight, does it cause that?
We do know that people. I always talk about my farm girls who are throwing their bales of hay around. We do see them have an increased risk of leakage and also prolapse. That's something that's a little bit unrelated, but somewhat related. When the bladder decides it wants to leave you and it just starts falling out, that is something that's related to carrying around a lot of weight and not supporting your pelvic floor
I'm surprised
appropriately.
You aren't worse off for carrying this family for so long.
Because when I was in the Marines, when I was in Iraq, our flak jackets that you had on basically 75 pounds, basically. So I was like, did that have something to do? So I didn't know.
And can I say that we've done studies on Marines in stress incontinence? We haven't. That's not a study that's not been done.
So here we can start today. I can help you out.
It's just a one.
All right. So we kind of already hit on this. Describe how menopause affects women's plumbing.
So it just as I said, you can have it's lack of estrogen in the vaginal skin that plays the biggest role, but also lack of systemic estrogen also affects the bladder. We know that people do tend to have more urinary urgency, urinary frequency, and leakage of all types after menopause.
Would this work for all of them? Or is there different procedures for each one of those? So
when we look at incontinence, we break it down to stress incontinence, urge incontinence, overflow incontinence, meaning that someone is not emptying well, and essentially you think of a big lake with a dam, and all of a sudden the level gets high enough, the water starts flowing over the dam.
Yeah,
that's overflow incontinence, and sometimes that's due to a neurologic injury, a back injury, or what have you. And then you can have mixed incontinence. That basically there's a combination, and the last one to mention would be functional incontinence. That's your 80-year-old. 90-year-old, they've just had a hip replacement. They get an urge to urinate. They know where they're supposed to be, but they have a hard time getting there. So it's just difficult for them to make it to the bathroom. So as long as there is a component of stress incontinence, the cough, laugh, sneeze, leakage, this could help people. Okay, and why would you choose this over the sling? So there's a very prevalent saying throughout urologists that this is never going to replace the sling. Okay. As you know, we talked about how the urethral hypermobility, the lack of support structures from the urethra to the pubic bone, can be corrected with a sling.
Do you literally tack it onto a part of the body?
It's mesh, right?
To raise it?
It is. It's so mesh is, and to explain what mesh is, it's essentially Prolene suture. Prolene was invented in 1956. It's the permanent suture that if a little baby is born with a hernia, we use Prolene to fix it. This is been around a long time type of suture. We used to use it to just kind of snag the urethra and tack it up near the vaginal tissues, and that was how we fixed incontinence originally. And what we realized is that because it's a point area of support, that we were more likely to put people into urinary retention. So they figured out that if we weave this into a little lace-like configuration, that it actually distributes those forces along the urethra. So you're less likely to go into retention. And yes, we do anchor it into my preferred sling is the Solix sling. It's a single incision sling, so I make a little incision that big just underneath your urethra, and I anchor it into the obturator internus muscle. You remember that muscle?
No. No idea.
I'm like, what?
No idea. So wait, I had a hernia in high school. Do I have some Prolene in me?
You probably do.
I do. I have mesh.
So polypropylene is essentially woven Prolene,
yeah. and it doesn't go away. I think it's shifted. Yeah. I think it's uncovering and allowing my hernia to come back.
So why would you say that? Why would you recommend this to me over the sling for now? So in all reality, both were good options. I think that what you had said was that it was important to you to get immediately back to exercising. Because how's the downtime on slings? And this particular sling that I do is not a 6-week downtime. It actually is only, I've had one gal do an ultra marathon, ran 39 miles, 10 days post-op, and she did great.
Oh, wow.
So I want you doing a powerlifting competition 10 days post-op? Probably not, because you might disturb the incision. But the sling is more invasive. There's higher risks. There's a risk of bleeding with this that we just don't see with bulking. There's a risk of more prolonged retention that we don't see with bulking that we can correct. But a sling is permanently fixing the urethral hypermobility. So someone who says the important thing to me is to have this one and done, I would say the sling is for you. If the important thing to you is I gotta be I gotta go record a podcast in 10 minutes, then that's the bulking procedure. It seems
like
more
the sling will help almost all situations, and the Bulkamid will help and be great for a smaller portion.
Well, and that's correct. And our success rates with slings are higher but then there's a risk of reoperation with slings. There's a risk of like I said, retention with slings.
You go back every other month if you want.
I would go back and do this over.
Well, and that's what a lot of people say. Even if it's not permanent, even if you have to go. And as far as durability goes, there was a great study done out of Germany looking at 1,200 women. They actually had done 1,200 cases, but they only ended up looking at about 400 women because that's the people who responded back. And of those people that responded back, about 70% of them were still very happy at 7 years.
Oh, shoot.
Now,
At 7 years.
And that's some cured, but much better was the criteria for happy. And so a lot of people out there say, you know what, I don't have to be dry, but gosh, I don't want to be using 6 pads a day. If I could just use 1 pad a day.
Wait, do people...
People have leakage that is that bad. That's severe.
I mean, you had to have been close. Well,
I run a jump rope.
She was using a product called Impressa.
Yeah.
And
that
I
was
know you
great
loved
for a
it.
while.
It worked great.
Oh,
and
yeah.
then towards it last year, it just all of a sudden stopped working.
Yeah, you probably just had a progression that tissue was just not loving it.
Talked about estrogen and its role in all of
Maybe
that.
because I started hitting perimenopause.
So
maybe that's why.
I have a very serious question.
Oh my God, it's not going to be serious.
So so the lack of estrogen could cause or help escalate the stress-induced incontinence. Can sex help? Can it increase the natural estrogen?
Did you see where he's going with that one?
Yes, she must have
Erin,
more sex.
Yes, that's what I'm talking about.
Hey, I'm not
This
adding.
is why she's
You can
named
pay
Dr.
me
Fun
later.
Nashville on Instagram. That's what I'm talking
But not only,
about.
I just had my testosterone, all my panel tests. My testosterone was 3.
I'm not shocked.
It's that low.
I need to know,
that is
does
very low.
estrogen increase after sex?
It does not necessarily. Unfortunately, we are reliant on our ovaries to produce the vast majority of estrogen in our bodies. And I'm going to take it up with God upstairs whenever I get up there.
Yeah.
Why does he want our ovaries to fail at 50? I don't get it.
I don't get it. It doesn't make sense, right?
It doesn't. Our pancreas doesn't fail at 50 unless we abuse it.
We don't
are
need
not
the pancreas
abusing our
at 2.
ovaries.
When is the you can take you don't need the pancreas, right? What's the organ you don't need? Is it the pancreas?
No, it's your appendix.
No, we need our pancreas.
Oh, damn it.
Oh my gosh. Sean,
Take my pancreas.
Well, yeah, might be dead.
It was one of the organs and it had a pee in it.
You know what? That was a question I did get. I didn't try this. Can you have sex right after you have this, or how long do you have to wait?
You probably noticed that you were a little bit irritated feeling afterwards.
Only for
I was
like
not pushing for sex after
He
this,
was
okay?
not. No,
For the record.
people ask me how long I had to wait.
Like, Sean, back off.
So as far as I have anecdotally heard of patients say that when they had sex about 2 days after, they were doing great, and then all of a sudden it felt like they hadn't had anything done. Well, this is a bulking agent. It's a gel. And depending on what you might be using for sex, if you were using any instruments, you might actually put some pressure on that area that would flatten the gel out before it becomes well organized.
If you happen to have a husband as large as me, would that be
exactly? So
He meant itty bitty.
So as far as safe sex, we usually say about a week is what the company wants us to tell you. But is it safe to do it the day after? Absolutely. But I've never, that's one patient out of a lot that have actually said that it made a difference to them. What we don't know is if maybe one of her blebs maybe just popped and released the compound. And it's hard to say for certain. So if you are going to, I wouldn't say that I would go for the roughest. Right.
Gentle sex.
Gentle
That's a love making.
You can all wait a few days after.
I would say
so.
You know what? Honestly, after I had mine, within 2 hours, maybe 3, I literally had feeling of nothing. I couldn't tell I jump roped. I didn't feel
you were
anything.
pretty excited.
I was I couldn't tell anything had happened.
It was pretty awesome.
How do I find a doctor in my area that performs procedures like this? Is there a certain kind of doctor, any gynecologist? What is it?
Well, you can't say anyone would do it.
Okay.
Most urologists are trained in bulking procedures.
Is it just urologists that specialize in women or urologists in general?
No, most urologists in general are trained in bulking. Now, most of those that are doing bulking are focusing on women. but also urogynecologists. So a gynecologist who focuses on the urinary tract also offer this. So the best way to find someone who offers Bulkamid specifically is to go to their website, bulkamid.com, and they actually have a 1-800 number. You can speak with someone at the company, and they will connect you. They will preferably connect you with someone who's at a center of excellence, meaning that they have done enough volume and they have been witnessed to do such a great job that they get that stamp of approval.
That's cool.
But they will tell you anyone in your area that actually offers the procedure.
I'm so curious as the group of people that had a bunch of names available for them to call this procedure, this compound, and they chose Bulkamid amongst all the other names that they could have.
It is kind of a weird name.
It is an odd name.
So you said it can last up to 7 years.
Mm-hmm.
What are the chances that people have to come back in like a couple months because maybe it didn't fill quite enough, or maybe it's leaked somehow? I don't know how that works, but like, what are the chances that? What is the percentage of people that need to go back in after the first one and have it redone pretty early on?
So it's actually within the first year, it's about 25% of people that may need that second injection. But
it's really easy.
It's really easy and it's very safe, and we're not losing any ground as far as preventing us from doing any additional procedures. So even if I did 3 of these, it's not like I would say, oh, we can't do a sling now, because there's no inflammatory response to this particular compound. That's how it's different.
Yeah, that's pretty cool.
Than all the other bulking agents that we've had in the past. We've been doing bulking for a long time.
And the way you talked about it is basically like, this is safe, this is quick, this is easy, that we're just trying to find where your happiness lies. Come on back.
That's exactly right.
And do certain people just absorb the compound, would you say? Or is it, how does that?
Well,
does the second procedure work better than the first, and so then they come back maybe after that one 3 years later?
So there's a variety of variables involved. There's an ideal layer to put this compound in, and it's not too shallow and not too deep. It's just right, that Goldilocks layer.
Yep.
And so if we get it in the correct layer, then it's not going to absorb. But if for some reason, no matter how you try to manipulate that needle, you do occasionally have cases where the material still preferably comes into a shallow layer. Those are more likely to pop is the best word I could use for it, because when we go back in, truly, we'll see a flat side and then 3 mounded up sides. So it's truly like something popping, and we go back in and we just go deeper, and a lot of times
the body just absorbs it. It's what, 98% water or something like that?
97.3%.
97.3.
To be exact. And insurance, so mine was covered by insurance. Some people have said their insurance doesn't cover it, which is odd because my insurance is self-employed insurance. Not like I have state insurance and stuff, like the really good insurance. So I was surprised when people said theirs didn't cover it.
Wait. I researched and bought our insurance,
Whatever.
and you think that I didn't get us pretty decent insurance? She's like, I wish I was employed by somebody. My dumbass HR got me whatever insurance I'm using now. That was me.
You could go get a job at the post office,
right, John?
Have some great government insurance.
Absolutely. Get some steps in.
There you go. But what causes some insurances to not cover this? It seems like it's a pretty standard procedure.
Well, you would think you would think that anything that would keep a patient out of the operating room would save the insurance company money and would make them want to cover it.
Because it's cheaper than putting a sling in.
It technically is. And so it's unfortunate that the reimbursement varies between states. So I know you have a multi-state, multi-country following, and so there will be people out there that in their particular state, the reimbursement doesn't even cover the cost in the office for the doctor. So a lot of physicians out there may only offer it in a surgery center setting. But for those who do offer it in the office, if your insurance does not cover it, then they hopefully might be able to offer a cash pay price for it. I have no idea what that would be because we don't encounter that.
I didn't see it either.
But it's that's not something that we have to deal with. We have a few insurance plans that will not cover our expenses in the office. So we take those patients to the operating room to do it, but they're usually open to that.
Interesting. And yes, when I'm saying I I don't pee anymore. I mean, I don't leak. I still go pee. And I didn't have a problem peeing after the procedure. I peed, like I was racing to the bathroom. I had to pee so bad and I peed fine. And before I even left the office, I peed again. And then I think as soon as we went out to eat and I peed again. So I had
this
no
was
problem.
A pretty immediate effect too, right? When you wanted to pee, you peed. But like before this, you had a 3P system you talked about for years.
Oh yeah, here, let's talk about this.
Oh yeah.
Here, so before I had this procedure done, I had what I called a 3P system before I would run. I'd pee, and then I'd go walk a little bit, jump off the treadmill, and I was too lazy to come back in the house. I'd pee again in the yard, and I'd jump back on the treadmill, start my run, and then jump off the treadmill and pee again. And then get on the treadmill and then just pee the rest of the run on myself. At that point, I'm like, okay.
I don't understand why there's any urine left. I don't understand.
It didn't matter. So like
that
if
doesn't
I
even make any sense. Okay, so yeah, there's an opening and there's stress incontinence, but why is there any urine left?
So our bladder is a reservoir. Our kidneys are constantly
and our bathroom is where you remove all
Or
the
a yard,
You don't
wherever
make
you
any
want.
sense, doctor.
But our kidneys are constantly making urine. Now, faster at
It's one of those organs you can
than
get rid
others.
of because you don't need to make urine all the time. I'm on to something here. Pancreas, don't eat it. At least one kidney, get rid of it.
Okay. Well, you're going to make a lot of surgeons out there happy with all these extra procedures. But definitely, as far as the urine goes, the bladder's job is to store. And immediately within 5 minutes after urinating, you have more urine in your bladder. And in fact, it's actually okay to leave a little behind after you've urinated, especially after we get older. We'll see people leaving 2 or 3 ounces behind and say that's perfectly normal. So
I try and get it all out. I
job.
found if I go hands off and then I scratch the top of my ass crack, it gets the rest of it out. It's really a system.
He's actually being serious.
Absolutely.
Too.
You just right above that and you just go and
I
it
have
goes
a
and then like
rocking
the stream
system.
hands again.
you are
everybody's
stimulating
got
a
it.
reflex.
Yeah.
You are not making this up.
Is that actually true?
Yes.
So that's what I need to do is stimulate my reflex. I need to scratch my butt crack and then it will.
It's right at the top of the butt crack.
There we go, ladies. That is the answer. Scratch your butt crack
It's like making me
before you
want to pee
start
right now
running.
thinking about it. It's like the best thing ever.
All right, that is
Hands
the
off.
answer. Scratch your butt crack when you're
But don't
before
hold
you
it.
start running.
You can't hold it.
Don't hold what? We don't have wieners. We're not holding anything.
There are other
Yes,
listeners.
very true.
Well, all you men, don't hold your wiener. Scratch your butt crack too.
Shit's great.
This is not validated by a urologist.
Oh, come on.
Dr. Erin.
You did because you were
But
saying
this is
stimulating.
seriously, this is amazing. Do you have anything that you think we missed on that somebody might need to know? Maybe so. It's not Bulkamid. It's
You got it.
Bulkamid.
Bulkamid.
Bulkamid. Okay. So Bulkamid is for a lot of people, maybe not for everybody. The best thing you do is go talk to your doctor, find out if you are a candidate. Some people might not be candidates, right?
You're correct.
Some people might not be candidates. You might not have the same issue as I have, so you might have, but there's things for those issues too. So the answer is I waited too long. I
Exactly.
knew I had a good pelvic
Yeah,
floor,
but
and I waited too long to just fix it. I would go back. I would have fixed it sooner.
Only
I
a couple
did go,
years. Like,
but
it was
I
only
did go to a
2020.
doctor years ago about having the sling put in, and they told me that.
6 weeks downtime.
Well,
so.
they did, but they also let me know it was recalled.
Yeah, well, it could have been. So there was some controversy about mesh starting in 2011. Basically, the attorneys found
After we
out
got
that there could that they could make a lot of money. What happened is they figured out that they couldn't sue doctors for very much money anymore because there was tort reform. So they couldn't sue them for pain and suffering. They could sue equipment manufacturers. So that's why you saw hips coming on under the chopping block. That's why you saw slings coming under the chopping block. And it was really more the vaginal mesh we use for prolapse repair. But yeah, there was a lot of controversy. And I will tell you, if you put it in poorly, if you put it in the wrong planes, if you put it too tight, if you put it too close to the urethra, too close to the vaginal wall, you can definitely have complications. I do not mean to undermine the suffering that some women have dealt with dealing with mesh. But when put in correctly, it's an absolute godsend. And I will say that even with both bulking and sling procedures, 4 weeks later, people are saying, "Why did I wait so long?"
I said it that day.
I don't care if it was, they waited 2 months to deal with it or 20 years. Everyone says that. So no matter what your type of leakage, no matter what you think your solution is, I strongly encourage you to go see your physician. Go find a urologist who deals with urinary incontinence and have a conversation and decide what's right for you.
Hey, you know what? Well, on that note, that is a wrap because you know what? We're going to start wearing colored leggings to run, baby. And no more holding your vagina when you
Colored
sneeze.
leggings from the Erin Opria Basics line.
Yeah. I got lots of fun leggings. But I know whenever I'd sneeze, I'd grab my crotch always. And I sneezed and I was like, oh, I didn't pee. This is amazing. It's the little things in life that bring us joy.
Yeah, a lot of joy because the anger it used to bring you was out of this world.
I mean, I can't be the only person because when sometimes I get off the treadmill, it's running down my legs and I just I've had it
No, anger. You go to anger real quick.
Yes.
It's so frustrating. And this is why I love what I do. I get to deal with quality of life issues and I get to dramatically improve people's lives.
You're improving my life.
Small procedures.
I do the laundry.
Choices.
Right? I have to deal with her anger issues. And you have helped my life.
But literally, I can say
that.
you 100% has changed my life. I mean, changed my life that day. When I jump roped, I was almost in tears. I was like, I cannot believe I'm not peeing. That's a first. I jump rope all the time and I pee every time. I pee. And I'm like, I pee. Sometimes on a jump rope, it would be 20 times in the yard I'd go pee. And it'd just be a little drop.
Did you scratch your ass crack?
I did not. Maybe that's where I failed. But ladies, that's a wrap, but you guys go follow her. So her Instagram is Dr. Fun Nashville. That is her Instagram. You guys can go hang out there. Maybe ask if you have questions. You can follow them up there. But she's been amazing. She's changed my life, and hopefully you guys can take care of your issue because I know so many of you have the same issue. But I can't thank you enough for coming on here and helping everybody else because you've changed my life, but I promise you're going to change so many other women because they're hearing this and they're like, wow, I need to go now too. So
you're single-handedly shifting the meter on people getting treated for incontinence.
Because it's
so thank you for making it public because a lot of people wouldn't have. And
people are so embarrassed to talk about it. It's a subject that should never be embarrassing. Actually, in my opinion, there's no subject that's embarrassing. You want to talk about sex, you want to talk about lack of sex, you want to talk about, I mean, if Addie makes me a horn dog and I'm wanting to have sex with the whole,
come back and
I'll
talk about
that too. She's the one that actually put me on Addie, so...
that was you?
Yeah, that was
her. Let's go.
Addie is a sex drug, so just so you guys know. We'll do a different topic on that. Hey, but you guys have an awesome day. Thanks for tuning in to Opria's Open Mic. If you have any questions, you can put them in the comments below. But you guys were amazing, and you were fantastic. And I think this was amazing today.
Thank you.
Thank you
for having me.
Bye, everybody.
Bye.
Bye.